So, welcome to Kerrie Oak's presentation, also from the Faculty of Health, and she's going to talk to us today about confronting case study challenges. Thank you so much, Kerrie.
Hola, mi nombre es Kerrie. Soy un hospitalario y estudiante de doctorado en el Centro Nacional de Medicina. Oh, hang on, wrong audience. Sorry. Hi, my name's Kerrie. I'm a herbalist and a PhD student at the National Centre for Naturopathic Medicine. Little did I know, when I, at 63 years of age, I would be learning a whole new language so that I could do my PhD. That's one of the challenges of doing a case study. Basically, I'm going to be talking to you today about the methodology and particularly what's behind the phrase, collect the data. But first of all, I would like to acknowledge the custodians and the elders of the lands upon which we are meeting today, the lands from which we come, and the elders past, present and emerging. I'd also like to acknowledge the wisdom keepers and the holders of the knowledge that I use as a herbalist. So, the case study approach, what is it? It's an intensive study. It's exploratory. So the how, the what, the why. It's about creating a hypothesis. It's an in-depth understanding of complex issues in space and time. I had to put the Doctor Who reference in. It's really simple. It's got some stages, like most methodologies. You select your case, you're defining your case, collect your data, analyse your data, and you report the findings. So simple. So I thought I had it together. I'd done case studies before. I had defined research questions. I was clear on what my cases would look like. I'd prepared an ethics application for international research, and Kennedy, you want to talk about the fun of ethics? You go and put an ethics application in and then they say, oh no, you've got to go through the full process because you're doing international. But no, different to what I'd be doing, no. And I even knew specific clinics that would meet my definition. But it's apparently one of the most demanding methodologies that you can find. I had to go for it. I don't do things by halves. And one of the main things, and this is one of the things really, is that the way you do it does not have a routine necessarily. There are steps, but they change. And what I didn't realise at the time, which I know better now, is that you should be prepared to modify your design and be flexible. And I've learnt a lot about what that means in some of the challenges. So obviously, one of them is learning a whole new language. One of the clinics that I wanted to include in my case studies came through in my scoping reviews. So those people who've seen my previous presentations know I've done a scoping review. I've identified a range of possible options for community-managed herbal medicine clinics. Clinics that use herbal medicine as a mode of treatment. Clinics that are managed where key decisions are made by broader community, not just patients and doctors or healthcare systems. So, the types of challenge. Learning to speak another language. Yes, we want to be part of your case study design. Oh, by the way, all of our herbalistas speak Spanish. That won't be a problem for you, will it? No. Raising the funds. So the budget is, for each case study site, approximately $5,000. That covers airfare, accommodation, and providing some form of recognition to the participants in the study. So that's gift cards in our case to the organisation that's hosting me, the 5 people who will agree to be interviewed, and to the key person who I'm liaising with within each of the case study sites to provide me with the cultural insights that I need. So for example, oh yes, Kerrie, Spanish. And we're talking and working with people who do not have a written skill. So all your documents and their reading is not particularly high. So you'll need to have very simple English. And I can tell you now that any application for ethics is not written in simple English. It is written in academic English. So then not only do these documents have to be translated into simple English, they then have to be translated into Spanish. And it's Latin American Spanish. So raising the funds for that, and so that's a whole challenge of where do you get the money from when the research is not part of an ARC grant or a grant from a health department because you're studying herbal medicine, that's out there somewhere. That's not part of the healthcare system. Navigating university approvals, and this is where I've learned an awful lot about how the university has procedures in place for getting approval to travel and multiple layers of approvals. So I thought, I want to travel overseas. If it was just me personally, I'd go to a travel agent. They'd get an idea of the best prices, the cheapest airfares, what type of visa would be best. So travel services is like the university's travel agent, so I'll just send them an email to get an email back that says you need to fill in our online form. So you go to fill in the online form and it asks for a GL code. What on earth is a GL code? So I go to my supervisor. How do I answer this question? Oh no, look here, just email this person and they'll... So I email that person and get back, go and fill in the form online. Okay, so, but if you're self-funded, so am I self-funded? Because the National Centre for Naturopathic Medicine runs an annual giving campaign, and my project is one of those that is subject and is being highlighted. So people are donating funds to the National Centre for Naturopathic Medicine for my project, but those funds are going into a university into a university account. Therefore, is it university funded or self-funded? Okay. And then you have to do international risk assessments, and I'll talk about that. So there's the planning the travel, working out the calendars. So I'm doing 5 case studies. I'm doing 1 in Australia, 2 in the United States, 1 in India, and 1 in Ireland. So making sure that, oh, look, this time suits that clinic, what time suits that clinic, and how about that clinic over there, and how does that fit in with my calendar and what I've got. And I have a complication because I'm on a carer's pension, so I'm subject to Centrelink rules about how long can I be outside the country. Negotiating. So we have a process of a memorandum of understanding with each of the clinics that covers off what my responsibility as a researcher is, what my role is, what tasks will I do, what am I asking the clinic to do, what will their key liaison person do, what types of documents am I looking for, how will those documents be made available, who am I going to be interviewing. So all of that gets negotiated. And of course we're doing that across multiple time zones. So those are kind of where the challenges have come. And some of the things that came up was, oh, why am I going to India? Because I decided, with 24 hours to spare, to put in a proposal to a major international conference to present the results of my scoping review. Going, I'm just putting this in so that I can, get used to writing abstracts and do all that. And I got the email back from them a couple of months later to say, I thought, yeah, they're going to say thanks, but no thanks. Oh yes, we really want you to come and do an oral presentation. What? Okay, fine. So I'm going to India. Hey, I'm going to India. I like India. So, well, if I'm going to go there for a conference, why not try to find a clinic over there, because they actually have some really interesting ways of doing herbal medicine. Ayurvedic medicine, Unani medicine are both well-accepted forms and are part of the healthcare system, so it's a different... I can come up with all the reasons for why I should include a clinic in India in my case studies. Then my partner and I had just come to an agreement that I would not add anything else to my calendar for the next 6 months, because August I'm going on a personal holiday, September I'm going to the United States, November I've got the conference in India. 2 hours later, a clinic that I had decided and worked out was not going to participate said, we want to be part of it. And we're in Dublin. Okay, so that's all happening. So those I hadn't been able to predict, and they're the sudden things that come in, and then you throw in the whole socio-political context of the world at the moment. Particularly, for example, travelling to the United States, where I have travelled before. But right, so now I have to really closely monitor the security alerts for that country. I've been to the United States before, I've had no problem with that before, but now I'm taking all of my planning to the nth degree of I know I'm going to need a completely clean phone. Just locking down my Facebook profile is not quite enough because they can unlock all that, but I'll need a clean laptop, I'll need to make sure I've got enough money, and that I have to prove I've got enough money, I've got to have my accommodation all in place, and at the end of the day, the security risk, the international assessment from the Department of Foreign Affairs and Trade might suddenly jump to a point where the university says, no, we won't let you take that risk. If you decide to go, it's on your own head. So how flexible will my airfare need to be? Which particular visa is the best one for me to get? So suddenly there's a whole socio-political context to take. So what do you do with all of those sorts of challenges which are hidden behind collect the data? You go into serious project management role. Very clear, very specified. Why am I choosing the clinics I'm choosing? Very tight. I would have task list on task list. Now I have a very set task list that is the very first thing that gets opened up on my computer every day. And I tick off all the boxes at the side. And as a good researcher, I record all the decisions. I've played around with budgets so much of where are my sources. So everything is so tightly project management documented. I never quite imagined that I'd go back into doing all that. And of course you do some serious fundraising. And so this is actually an online auction site, an online donation site. So I've set myself a goal, and if you want to help, feel free to come and talk to me. My goal is $10,000 by the end of July. Every dollar that I raise is a dollar I don't have to take out of my pension. So that's it. Thank you. And did you like the Spanish?
So, yeah, that was amazing. Thank you so much. That's a huge journey. I mean, you are learning skills way beyond collecting data.
Oh.
Okay. Questions and comments for Kerrie?
Kerrie, that was fabulous. Thank you so much. I am curious as to how you maintain your mental health through all of this.
My partner would probably say not very well at times. And that's probably one of the areas where being able to come and present and talk here is good, because I get to go to people who understand. I have a couple of trusted colleagues who know when I message them on WhatsApp that if I'm messaging them through this channel, that's serious, because otherwise I wouldn't use that app. So it's like setting up your techniques and mechanisms, having a partner who tries to understand, even when they're not an academically minded person, but they really try to understand. It is a challenge, yeah. And it's probably one of those extra things that should be in there, of making sure that behind and underneath all of that is, this is just a PhD. This is not life or death. Except when I travel to certain countries, maybe.
Well done, and I appreciate your ability to maintain a sense of humour and some joy.
Yes, good feedback. Did I see some self-care days scheduled into that schedule? Did I read that correctly?
No.
Some care day, something, I didn't read
there's... I kind of probably, and this is probably something that I'm not necessarily a person who schedules in self-care days specifically.
I might have misread that.
But I think it's because I actually get... my PhD is my happy place. So in fact, when I'm really down or not coping with the world well, if I can retreat into my PhD, I'm happy. So, yeah.
Excellent. Well, you brought a lot of energy to that presentation, which we appreciate, being late in the afternoon and everything. Any last comments or questions for Kerrie? Yes, thanks, Erin.
Has anyone ever told you that you're an overachiever? And that's coming from a room of many PhD candidates. I think that your project, the scope of it is amazing. I think your presentation had so much character, and it really shows us how your mind works, which seems to be this beautiful intersection of creativity and profound logic. So I just wanted to thank you for sharing for us and giving me such a different perspective on what a PhD can look like.
My message probably is that while you are still enjoying your topic, you are still doing a great thing. If you start to lose that connection to your topic, that's when you really need to reach out to people, whether it's to your supervisors or to colleagues or to somebody, and go, I'm not sure now, because I do go through those periods, but I still, obviously, when I talk about my topic, I'm still really...
Yeah.
And people who've seen me present right from the beginning is I've been like this through 5 praxis presentations.
Yeah.
So, yeah.
Brilliant. Thanks so much for sharing. Excellent. Thank you.